Hello, I'm Jane Fisher. I'm cardiology lead for the Trust, and I've been a consultant cardiologist at the William Harvey for the last 15 years. We have 38 inpatient beds, which is a very big unit, the biggest medical department in the hospital. Those 38 beds are divided into 10 and sometimes 11, because we may use a side room, coronary care beds, and another 28 beds for the more general cardiology of heart failure, AF, and non-life-threatening emergencies. The non-STEMIs go to an ordinary cardiology bed. The ST elevation MIs come in on the primary PCI pathway and go straight to the cath lab and then to coronary care. We also have 5 day case beds for people who are coming in for procedures in the cath lab, for them to recover and then go home the same day. We're an expanding department with currently 8 consultants. There are always 2 consultants on the ward. One covers coronary care, one covers the other cardiac patients, and there is always at least 1 consultant cardiologist in the cath lab. We have 2 cath labs that are purely for angioplasty and 1 lab that is used just for pacing.
My name's Chris Johnson. I'm one of the F1s in cardiology. So it's a big cardio unit and we've got a few F1s looking after it. That's split into looking after our general cardiology patients and the CCU patients, which should all be on Cambridge J. We normally start our ward rounds at 8:30 and it will be led by either a consultant or a registrar. The consultant would change on a weekly basis, and there'll be a consultant looking after our general cardiology patients and a consultant looking after the CCU beds as well. During the ward rounds, occasionally you get a chance to examine a patient, and you can also sort of discuss management options with the consultants and the registrars. After we finish the ward rounds, it'll be getting on to the jobs, and naturally we'll start with the most urgent ones first. So if there's any sick patients to deal with, after that's sorted, going on to the discharge letters to make sure everyone gets home in time, because it is a few hours with pharmacy and everything, getting all that sorted. And then doing some of the more routine things, and by the end of the day, checking all the bloods, putting out bloods if necessary for the next day. And then we've generally wrapped up by 5:30.
When the junior doctors start on our ward, we offer them an introduction pack to welcome them to the ward and just sort of give them some idea about what the ward is about, so they don't feel out on a limb, they can feel part of the team. We offer lots of support and advice to all of the doctors, making them feel welcome from day one.
Hello, I'm Emily Kelland, cardiac coordinator of the William Harvey Hospital. Doctors looking after inpatients on the ward frequently visit us to request diagnostic investigations from echocardiograms, pacemaker checks and heart monitors, or any other requirements needed.
We take a higher number of out-of-hospital arrest patients than other primary PCI centres. So you not only have to manage the life-threatening arrhythmia at the time, but you also see them go through their post-brain injury recovery and getting back to normal life. As I say, we have a heart failure service where we intensively investigate whether we can correct the heart failure. We have a research involvement, and we have nurses and palliative care involved as well. So there is a very wide range of cardiology available to learn about on the wards, and the ward rounds are a superb learning environment.
It's a general medical on call, so you're clerking sort of to any medical patients that are coming into the hospital as opposed to purely cardiology. We won't be on call during our 3 weeks on the ward, so those 3 weeks will just be 8:30 to 5:30 looking after our sort of normal ward patients. After that 3-week block, we switch into a 2-week on-call block, during which you'll work fewer shifts but longer hours, so they're generally sort of 12 or 13-hour shifts. And that's generally just clerking new admissions down in A&E and CDU. During which you're carrying the on-call and emergency bleep.
Hello, my name's Nayan Su. I'm one of the Foundation Year 2 junior doctors working in cardiology on Cambridge J. As a Foundation Year 2 doctor, the general medical on-calls are slightly different from the F1s. We also do nights, so as well as clerking in the daytime shift with 9 a.m. till 9 p.m. We do the 9 p.m. till the 9 a.m. shift, and this constitutes as well as general clerking overnight, but also you might be asked to do the wall cover overnight, which is to look after all the general medical patients at night who are sick and unwell. This is quite a very hands-on first-hand experience because you're normally the first doctor on the scene and have to make the decisions by yourself. It is well supported in the sense that there's always a medical registrar available at night as well if you need them.
There are formal teaching sessions run through the general medical faculty, so there's a very good X-ray teaching session on Mondays, there's grand rounds, and there's specific F1, F2 teaching and CMT teaching. But cardiology also has a JCC, which is where we discuss patients who might be for angioplasty or surgery or valve surgery. We have fortnightly educational meetings, which are either on a Monday or a Thursday lunchtime, and they are quite specialised but very interesting for those who are thinking that they might want to go on further in cardiology.
Our formal training as an F1 will mostly be through the education department teaching sessions, which are just for all the F1s, and they happen on a Tuesday and a Thursday.
The good thing about cardiology at the William Harvey is that it does primary PCI here and intervention. So if you get a chance to get away from the busy wards, you can go into the cath labs and see an angiogram, to see them stenting, to see a pacemaker being inserted in. And also it's a great chance to go downstairs to the cardiology outpatients as well and learn a bit more about echocardiograms.
Within the department, we have consultants who are specialist interventionists, mainly interested in angioplasty, PCI. We have others that are interested in complex pacing or imaging. The cardiac MRI service started recently and is the only one in Kent and has saved our patients having to go up to London for these specialist services. There's also stress echo, and there's a lot of cardiac CT. EP is done on site by visiting cardiologists from London, and we have a specialist heart failure team. It is a high intensity job. The team is large, with 8 junior doctors, 8 middle grades and 8 consultants. So there is a lot of team working, and the cardiac rehab nurses, the heart failure nurses and the DC cardioversion nurse will all be your friends and help you through the system. The nurses on the ward are extremely knowledgeable and helpful.
Hi there, my name's Tara Vaughan. I'm one of the cardiology nurse specialists here at the William Harvey. We are a small team of 3, and we see all the patients that have had primary PCI, so post-MI, and the NSTEMIs on the wards between coronary care and Cambridge J ward. With regards to the junior doctor's role, obviously they can come to us quite a lot because they can ask us questions. We like to have them to come and sit in with us to actually listen, and they normally gain an awful lot from us.
So it is a busy post, and we've got a fair few patients to look after, and there's lots of jobs to manage, but it is a very enjoyable experience. The ward's fantastic, and the nurses, the cardio nurses, are superb, and they're a great source of advice for when we're trying to figure out what to do with patients, and particularly when people are going home and they're asking questions about lifestyle things. The nurses often have a lot more experience and are superb from that side of things. It is busy. But generally it's manageable, and because of the good attitude from the ward staff, it's quite an enjoyable placement to work on.
There is a pharmacist available on the ward if you need them, who you can discuss with about antibiotics and their interactions, and also for cardiology medication interactions with other general medical medications as well, and for any information you need.
So in terms of leave, it's all organised via Dr. Fisher, and in terms of getting it in early is the key point. So with us, we started emailing prior to starting the rotation and had it all sorted out very early on. So if you can email her at the start, then we generally like have a little meeting and work through when everyone wants their leave, and then we can book it accordingly, get it all sorted early on, and avoid having short staff days and more painful times on the ward later down the line. So it's good to have it sorted in the first week if you can. So in terms of the apps we use, MicroGuide is a fabulous one for figuring out the local guidelines for antibiotics. Makes it a lot easier and avoids unnecessary conversations with the microbiologists. But naturally, in things that aren't covered or more complex cases, they're easy to get through to and are fabulous sources of advice. We've also got the emergency handbooks locally, which is constantly being updated and is a very useful, quick guide for managing various emergencies, electrolyte disturbances and things like that. Nice and sort of simple and easy to use. And the other one is naturally the BNF on the phone, which is a nice and easy source for sort of doses and any issues that you might run into with the sort of medications we commonly use. Because there's a registrar and a consultant for the week, there'll always be someone you can go to, and if generally you'll have their numbers so you can get through to them that way, and if you can't, there's always the other consultants who will be around because we've got a fairly large department, so there's always someone you can get advice from.
Cardiology is a really rewarding speciality. It's very hands-on, it's very fast-paced, it's a great learning environment. I'm enjoying it for the sole purpose that I feel like it's made me a better doctor. Everybody's very friendly, everybody's very motivated and eager.
This is a very dynamic and expanding department with lots of opportunities for learning. The feedback from our previous trainees is that while they have to work hard, it really is a strong, formative and enjoyable experience, which really gives them confidence to deal with cardiology emergencies in the future.
The best thing about the rotation is the staff, to be honest. You get a lot of interesting medical conditions and cardiology conditions that are quite exciting, and particularly some of the more emergency and urgent ones where you're sort of in there and it's a lot more adrenaline and high-paced. But the thing I have enjoyed most is definitely the attitudes of the staff, and they're all just so positive and very friendly and easy to get along with. So that's been the highlight, I'd say. We're
looking forward to you joining our team, and I think you will find it a very enjoyable and memorable experience working with us.